terms of evidence, I also helped craft the recent ASCO guidelines for cancer-related fatigue. And right now, yoga is in fact recommended as one of the therapeutic treatments that you can use for treating cancer-related fatigue. The evidence from this trial would suggest that it also could be recommended for anxiety as well as overall mood disturbance in patients. So the evidence base is really there already to begin to suggest it. A second phase 3 randomized clinical trial would raise that level of credibility, and I think there would be no question after that. And hopefully the results from our forthcoming trial will show that. In terms of implementing this in a clinic, um, really, it doesn't take as much as I think many people would think for this to be implemented for patients and survivors in clinics. It's a gentle hatha yoga and restorative yoga, which nowadays in most communities across the United States, there are certified instructors who are able to teach these types of yoga. It's also a very short 4-week intervention, and it's face to face where people actually attend classes and then they were encouraged to do home practice. And what we saw in our patients is that they did attend 2 classes a week for the 4 weeks. They also did at least one other day at home. So for this to be implemented in a clinic, clinicians, nurses, social workers, anybody who's on an oncology care team, the best way to do it is to familiarize yourself with resources that are available in your community. There are yoga studios. Yoga is taught at YMCAs. It's taught at most fitness centers nowadays, and even many cancer centers are offering their own yoga classes. So you would want to refer your patients to those classes. And what is important about that is making sure that you have yoga instructors who are really good yoga instructors, obviously, but also people who have experience working with cancer patients. And if they don't, then maybe experience working with other individuals who have other types of chronic illnesses like heart disease or diabetes or other things like that so that they can understand how to modify some of the yoga postures and what might be needed in that context to work effectively with cancer patients and survivors.